My name is Dr. Richard Trieu, minimally invasive gynecologic surgery fellow at Christiana Care Health System. Today, I will briefly summarize our manuscript, Navigating Operating Room Resource Shortages, Cost, Sustainability, and Environmental Stewardship, co-authored with Drs. Elissa Trieu, Dr. Schneyer, and Dr. Kelly Wright. The healthcare sector stands at a critical inflection point where environmental sustainability and ongoing supply chain disruptions are constantly reshaping how we deliver care in the operating rooms. As both stewards of human health and significant contributors to healthcare's environmental footprint, surgeons have a unique opportunity to lead meaningful change in surgical sustainability. In regards to environmental impact, the operating room is disproportionately responsible for that footprint. Globally, healthcare contributes to 4 to 10% of greenhouse gas emissions, making it the 5th largest emitter if it were a country. Within hospitals, operating rooms account for up to 30% of total waste and the majority of regulated medical waste, despite comprising a small physical footprint. In regards to supply chain disruptions, recent disruptions have exposed the fragility of our system. In 2020, nearly 1/3 of hospitals reported shortages of personal protective equipment and 40% faced respirator shortages. Climate events are now compounding these issues. For instance, Hurricane Helene triggered a greater than 5-month IV saline shortage back in 2024. These disruptions now coincide with rising costs. Tariffs are projected to increase operating room supply costs by 10 to 25%. For example, single-use energy devices, the most expensive on the list, are expected to rise from $329 to $395 by 2026, with tariffs contributing approximately 15 to 20%. A typical procedure using multiple trocars and energy devices may see costs rise by over 20%, largely driven by inflation and the tariffs. With regards to sustainable solutions to address these challenges, several evidence-based strategies have emerged. Reusable resources not only reduce the carbon footprint, but also protect against supply instability. Reusable laparoscopic devices save 122 kilograms of waste per case, and reusable gowns reduce waste by up to 70%. One large hospital saved $4 million annually using reusable fluid management systems and sterilization containers. In regards to reducing waste and optimizing use, even more impactful is eliminating waste before it even happens. Nearly 30% of surgical supplies opened during a case go unused, and this is often due to inaccurate supply prediction, overpreparation, and outdated inclusion. As resource instability, climate pressure, and financial constraints grow, it's clear surgeons must lead. Integrating sustainability and cost consciousness into everyday surgical decision-making is an opportunity to build a more secure, responsible, and resilient operating room for the future. The authors would like to thank the Journal of American College of Surgeons and the editorial team for their consideration and the opportunity to discuss this growing topic.